First on Fox tonight, health boards in 6 of Tennessee's largest counties could soon be stripped of their power. A bill that would do away with their ability to implement their own policies is now moving forward in the state legislature. This measure would give that power instead to county mayors. Fox 17 News' Jackie Del Pilar tonight asking the lawmaker behind the bill why he thinks politicians are better equipped to make these decisions than local doctors.
Health boards are usually made up of doctors, nurses, other medical professionals, and are appointed by elected leaders. But this bill would only allow these boards to work as an advisory panel and not be able to do anything beyond making suggestions.
The new bill would take policy-making power away from health boards and hand it to county mayors. Lawmakers behind the bill say it's about a balance of power.
The health boards literally have the ability to trump the elected official, the elected county executive, in each of these 6 counties.
Representative Jason Zachary sponsored the bill after the health board in Knox County put in policies the county mayor disagreed with. He wants the health boards to act as advisors, not policymakers.
Now that this pandemic has kind of set a precedent and revealed the power of the health board that has been given to them through the code, we have to address it now, so that way we don't have problems in the future.
The bill targets the state's larger counties that operate independently of the state health department, including Davidson County. So far, Mayor John Cooper and the Metro Board of Health agree on the same policies. A member of the board tells me the bill sends a message of mistrust toward medical experts.
I think that us being able to not enact policies shows a significant distrust for our expertise and essentially removes whatever responsibility and power we have towards helping the people of whatever city we are responsible for.
I brought these concerns to Representative Zachary.
What do you say to the folks who say, I want my decisions to be made by those medical experts versus a politician?
Yeah, well, then they need to vote for a doctor to be the next mayor. That's not the way our structure of government works. We elect an executive to make decisions in all aspects of our lives.
Zachary says he still values the advice of medical experts, but wants to ensure the decisions lie with the people who are directly accountable to voters.
The bill passed a subcommittee hearing today, but there's still several more hearings to come before this bill could end up on the governor's desk.
Tonight in the Path Forward, traveling hours from home just to get your first dose of the COVID-19 vaccine. That's what some mid-state residents desperate to get vaccinated tell us they are being forced to do after having no luck closer to home. Fox 17 News' Nikki Jenowitz live downtown at Legislative Plaza with more on why the state discourages this and what they're doing about it.
Now, Scott, it seems just about everybody knows somebody who's had to travel across the state to get their COVID-19 vaccine, whether it be personally or on Facebook. The state calls this vaccine tourism, and they have spoken out against it. But patients that I spoke with told me today that after weeks of sitting on the wait list, they really felt like it was their only option, and they only wish that the state was doing more to prevent this.
Out of patience, out of options, out of luck. After weeks on the wait list, that's what prompted Davidson County wife Pamela Larson to log onto Facebook and ask for the help of strangers getting her 78-year-old husband vaccinated.
I guess I wanted assurance. Was I doing something wrong? People responded in droves with excellent suggestions. I had friends tell me that, you probably needed to register in other counties besides Davidson.
The state refers to this as vaccine tourism, something they adamantly oppose since the rollout began, but seem to backtrack on today.
What do you say to people who are just desperate to get this vaccine, but they can't seem to get one in their own county?
At the end of the day, this is a federal resource. And so anyone in this country is entitled to this federal resource, regardless of county or even state of residence. Because we do have a population-based allocation, it works a lot better if you stay in your own county, but that is not an absolute restriction.
Pamela's new friends on Facebook also told her which county she should go to. At this point, there is no uniform statewide system to connect Tennesseans looking to get vaccinated with available appointments. Dr. Lisa Piercy saying today that last Monday, a statewide scheduling platform was launched, but only for our 89 rural counties.
The Metro Health Departments have been given the opportunity to to get on that same system. Because of their size, we want to make sure we work out those couple of little kinks and wrinkles before we test it at scale in the larger metro health departments.
That could take weeks. In the meantime, people in Pamela's position will have to rely on the kindness of strangers on Facebook.
I think it kind of says a lot about our system, and bless the hearts of all the people on the HIP Bellevue page.
Now, Pamela did update me today that her husband was able to get a vaccine appointment, but it's not here in Davidson County. It is in Cheatham County, and she says that is a drive that they are more than willing to take.
In the path forward, more than 1 million residents have received jobless benefits since this pandemic started. But just how many of those claims were paid to thieves instead of deserving Tennesseans? Tonight, we're asking the Department of Labor what's being done to ensure jobless benefits don't end up in the wrong hands. 1,062,306. That's the number of initial claims for unemployment benefits filed as of February 13th. Amy Bagley is just one of the anxious mothers who says the waiting game continues and eviction is a reality.
How has not receiving unemployment benefits impacted your family?
The rent has fallen behind, all the bills are behind, the car's behind.
She filed for unemployment benefits July 25th.
Typically, we would distribute around $200 million in unemployment insurance. In 2020, that number rose to $6.3 billion.
Tuesday's Senate hearing included the Department of Labor and Workforce Development's budget presentation to the Commerce and Labor Committee. Each year, they bring their projected budget for committee review. One topic on today's agenda, fraudulent jobless benefit claims paid to identity thieves.
Well, I put my case into an appeal process, and it stated that someone would look at my appeal within 5 business days. That was on February 10th, and I have not heard one thing.
We contacted Department of Labor and Workforce Development spokesperson Chris Cannon to ask if there is a current estimate of how many people were impacted. Cannon responded by writing in part, to protect the integrity of Tennessee's unemployment program, the Department of Labor and Workforce Development cannot discuss details involving ongoing fraud prevention tactics, investigations, or the scope of potentially fraudulent activity.
Do you think 6 months down the road, there will be positive changes where people won't have to wait so long?
I think number one, the legislature is going to demand changes be made. I think the department is hearing from legislators demanding those changes be made.